Ladies and gentlemen, there's no way we can talk about sugar and taxation without mentioning Mexico. Mexico has been studied most robustly for the longest period of time, and we are fortunate to have one of the leaders of the investigation here with us today. And I invite Dr. Arantxa Colchero to come forward and tell us the Mexican story.
Thank you very much. I'm very pleased to be here, and thanks for the invitation. So what I'm going to do is to talk a little bit of the background in Mexico and why and how the tax was implemented, and then I'm going to show you the results of the evaluation. Okay, so in Mexico, we have a very large burden of chronic diseases. In 2012, so before the tax was implemented, overweight and obese reached 70% among adults and 33% among children. We have a very high prevalence of diabetes, 14%, which represents a high burden. And Mexico was the first consumer in the world in 2011, and now we're second after Chile. So, and we found that added sugars represent 12.5% of total energy intake, which is above WHO recommendation. And among these added sugars, 70% are sugar-sweetened beverages. So this is a good start to do taxation in Mexico, because consumption of SSB is very high. So my institution, the National Institute of Public Health, so INSP, made several documents recommending a comprehensive package of interventions to tackle the obesity epidemic, and in particular to implement taxes to sugar-sweetened beverages. And there was a book that was published in 2012, The Obesity in Mexico, where a list of recommendations were suggested, including taxation. And in 2013, the government presented the National Strategy for the Prevention and Control of Obesity and Diabetes. They used most of the recommendation on the book. And those in bold are those who have been implemented, some poorly implemented, others, none of them have been evaluated except for the tax. So in Mexico, we have a regulation for food and beverages in schools, although it is very difficult to see how many of the schools are compliant with the regulation. So one of the strategies is to implement the consumer-friendly front-of-pack labeling, but we haven't yet achieved that. We have the GDAs and the voluntary sealing, so a lot of work to do there. We have implemented a regulation for food marketing to children in television, but only for those programs targeted to children, but children watch other programs and stay overnight, so it's limited. We have two taxes, an SSB tax and a tax to non-essential high-energy dense food. I'm not going to talk about that, but if you have questions, I can answer that. And we have some promotion of public awareness among the public, but it is very limited. So during 2012 and 13, there was a lot of debates in the country related to a possible implementation of a tax. The context is that the industry is very strong in the country and was opposing the tax. And we didn't have any support from the Ministry of Health. So I'm glad you do have support from the Ministry of Health. In 2012, there was an initiative, a senator presented a proposal, but it was not discussed at the Parliament, at the Congress. Then in 2013, the government presented a proposal that was accepted. And part of the success has to do with strategic partnership. There were 3 groups working before the tax was implemented. So there's a very interesting group of advocates who would do a lot of campaigns to raise awareness among the public. There was a group of very young people looking at convincing senators and deputies, and they would use very interesting materials to convince them. And then the academia, mostly INSP, working on the evidence and sharing the evidence to the other groups and presenting in several seminars, and meetings with the Ministry of Finance, who supported the initiative. So despite this strong opposition from the industry, in January 2014, an SSB tax, an excise tax was implemented in Mexico. That's a 1 peso per liter, about 10% increase in price, so it's a moderate tax. To all non-alcoholic beverages with added sugars. It doesn't include 100% juices, and beverages with artificial sweeteners that we do not recommend for children, so because they get used to sugar, but they do not have a tax in Mexico. The tax, because it's a tax to the volume, is higher for the larger package sizes, which is positive because we have these large packet sizes in Mexico are relatively less expensive. We have a lot of variability in prices. I don't know if this is the case here. We have 3 little bottles. It's terrible in Mexico, and they're less expensive. So this tax is paid by the producer, but is reflected in consumer prices. And one drawback is that it is adjusted to inflation when the cumulative inflation reaches 10%. It just reached 10% last year, and it will be adjusted this year. So it's losing its value. Just a little theoretical framework on the potential impact of a tax. And then it is related to the evaluation that we are conducting. So the tax can have an effect on consumption through different means. One obviously is prices. So if prices increase, and that depends on the structure of the market, on price elasticities of the demand and the supply. If prices increase, then we would expect a reduction in consumption. But also, the tax could be a signal to the population, that meaning that these beverages are not good for health. So the signal in behavioral economics is also part of the means where people can respond, so changing social norms. And also depending on how the policy is framed, it could also incentivize behavioral change. Of course, there are other public health policies that could, at the same time, respond. Good to document and to be aware of the response of the industry can attenuate the effect on consumption, because they can have new products, they can reformulate, they can have lots of campaigns, and they can have a lot of information in the press against the tax. And eventually, because the literature says that high consumption of sugar-sweetened beverages is associated with weight gain, diabetes, and other chronic disease, one would expect that if consumption is reduced, then there would be an effect on health. And of course, this is a more distant outcome, and it is difficult to evaluate when you don't have an experimental design. You would have to have a very large sample size. So one needs to be aware of the difficulties in evaluating the effects on health. But why wouldn't you expect that there is an effect on health if there is a literature showing this? So there are concerns that the reductions in consumption could lead to reductions in employment. So one needs to be aware and study that. And there's also the concern that the tax could be regressive because the poor spend more of their income on food and beverages. Now, of course, that can be attenuated if this is a group that reduces more their consumption after the tax is implemented, or if there are inequalities in health in the country and there is an effect on health, then probably that would benefit the poor more. In our country, we don't have such disparities in health, but yes, we have on health expenditure because we don't have universal coverage. So if there is an effect on health, maybe we could expect a reduction of pocket and health expenditures. And of course, even with that, with the revenues that are collected from the tax, the government can use these revenues to compensate for potential losses. For example, offering potable water or other healthy options. And finally, revenues could also be invested in other public policies. So within this framework, I'm going to show you the results for Mexico. So we first analyze, the first thing to do is to see how much the industry is passing the tax to prices. So in urban areas, we analyzed prices, and we found that on average, remember that the tax is 1 peso per liter, so on average, they pass through completely. So they increase 1 peso per liter in 2014 compared to 2013. And we found that the increase was higher for the carbonated beverages compared to the non-carbonated beverages. And this is because these are more expensive and the price elasticity of these non-carbonated, which are juices and flavored water, is higher. But they are not very consumed in Mexico. What we consume are sodas. There was also a differential effect on prices. The higher prices were in the smaller package sizes because they probably they wanted to incentivize, continuing incentivizing the sales of the larger packet sizes. And there were also heterogeneity by region. We also analyze prices in rural areas because we don't have prices in rural areas. We collected the data. And what we found is that the tax did not pass through completely. Prices increased by 0.7 cents in rural areas. So this is something to take into consideration. And the reason is that, again, the price elasticity there is higher. So the industry knows. So the industry can do price discrimination, but for urban, the tax passed completely. So now I'm going to show you what we did to see how, after the tax was implemented, how household purchases as a proxy of consumption changed. So what we have, we used a panel of households that live in areas with 15,000 inhabitants or rural, urban areas. And in this panel, we have information on daily purchases of processed food and beverages in stores. And we have data from January 2012 to January 2015. We conducted the first study in 2014 and found that there was a reduction in taxed beverages of 6%. So there was a reduction after the tax was implemented. Just very quickly, because we don't have an experimental design, we don't have a control group. And we found that there was a slight decrease in purchases of tax beverages before the tax was implemented, it was very important not to overestimate the effect of the tax. So what we did is we compared what you would expect in the blue line, what you would expect if the previous trend would continue, with the observed trend. And so we compared both and to avoid overestimating, and we did a fixed effects model for those who are interested in the statistics, and we controlled for many variables that are associated with the demand for SSBs. So you need to do that because you don't have an experimental design. And so what we found in the second year, so the first year we found a reduction of 6% in tax beverages. Interestingly, in 2015, the second year, we found a higher reduction, a 9.7% reduction. This is interesting because, as I told you, the tax had not been adjusted to inflation, so it was losing its value. So probably is not only a response to prices. Maybe we don't have any evidence of that, but maybe social norms are changing. Maybe it's really a signal, the tax. And overall, in the two first years, we found a reduction of 7.6%, and that's about 5.1 liters per capita per year. In terms of the untaxed beverages, so that mainly includes bottled water, we found in the two first years of implementation, after implementation, an increase of 2.1%, and that's about 6.6 liters per capita per year. So it's more than the reduction in tax beverages. So it seems that people are substituting for water, although they have to buy, and this data set doesn't have any information on how much potable water people drink. We know that people are consuming more potable bottled water. What is interesting also is that looking at the differential effect of the tax among the different socioeconomic groups, we found in the first year and in the second year that the reduction was higher among the poorest. So 9% reduction in the first year and 14% reduction in the second year. Again, this is good because the poor are those who carry the higher burden in terms of the financial burden of the tax. So the reduction was higher among this group. So we conducted, so this was urban, findings in urban areas. We also have public data that we used to analyze how household purchases change at the national level. So what we found, again, and it's interesting because the results are very robust, we found in 2014 a reduction in 6.3% in 2014. So this is using the national income and expenditure data in different rounds previous to the implementation of the tax. We also found that the lower income household had a greater reduction, a 9% reduction in 2014 compared to the pre-tax period. Interesting, we found, and this is expected based on the results I show you on prices, that in urban areas, the reduction was higher. It was 8%. And in rural areas, it was -4%, partly because the taxes did not pass completely to prices. Another interesting result is that we found that households with children and adolescents had greater reductions in tax beverages of 10% compared to those who do not have children and adolescents. It doesn't mean necessarily that children and adolescents are consuming less, because this is household data. We don't have individual consumption here, but it suggests that this is maybe the case and has to be confirmed with consumption data. So we also, I'm sorry. Okay, so we also two groups in INSP analyze the potential effects on health through simulation models. And what they found is that there are potential benefits using the results of the evaluation, that there are potential, so that a 10% reduction would lead to about the reductions in diabetes cases and stroke, and would save $983 million US. So the two studies show the potential effects on health in 10 years, diabetes and overweight and obesity. So the other concern was employment. So what we did is we analyzed, we have data, public data in the country. And so we analyzed different surveys to see if there was an effect, a negative effect on employment. So we analyzed data from the manufacturing industry that produces the beverages. We also looked at the surveys on commercial establishments, because that was another concern, that the stores will lose because they would sell less beverages. And we also analyzed the unemployment rate. So we used statistical models to see if there was a change after the tax was implemented. And it's very interesting because you can see in the graph that this is for the beverage industries. This is employment in the beverage industry. So you can see that there was a decreasing trend in employment in the beverage industry because they've become more productive. It's not that they were selling less, they've become more productive. Probably this is happening everywhere in the world. And after the tax was implemented, you can see the vertical line, there was a very small increase in employment. That's not related to the tax, but it was extremely small. But the message is, there's no effect on employment in the beverage industry or in the industry that produces the non-essential energy-dense food, because we also have a tax on these products. We also analyzed, as I mentioned, employment in the stores, big, smalls, and medium stores. And what we found, again, is there's no, it's hard to pass the, if you can help me. Okay, so this is the trends in employment in commercial stores. And so you can see that after the tax was implemented, again, there was a very small increase in employment, not related to the tax. But there's no negative effect of the tax on employment. And you would see that in small, medium, and large stores. And finally, this is the trend and the predictions from the model on the national unemployment rates. So there was an increase in unemployment when the crisis in Mexico, and then there have been reductions, and after the tax was implemented, the reduction continued. So there was, again, not an increase in unemployment in the country related to the tax. So revenues in Mexico are big, are important, and it's really hard to, okay. So the cumulative revenues from 2014 to 16 are about $3,000 million. And the problem in Mexico, I don't know what's the case in Jamaica, is that taxes cannot be earmarked. And we have had many discussions with the Ministry of Finance and said there is no way this can be earmarked. So although the fiscal law, and this is in the last meeting we had with them, the fiscal law contemplates that some resources should be invested, but we have no idea how much of the resources have been invested. We know that water fountains have been installed in about 9,000 schools, but we don't know the target. We have many more schools than 9,000, but it's a beginning, and it's using the revenues. So in conclusion for Mexico, what I've shown you is that First, prices on average increased, but they didn't increase as much in rural areas. This is something that requires a specific attention. We found that there were household purchases of taxed beverages decreased, and they were higher among the poorest. And we haven't published that, but as Barry mentioned, we found also that the greater reduction were among those who consume more. And this is important because these are probably the ones that have more obesity problems or chronic disease problems. So this is a good finding. The reduction is 10% among the group of high consumers. We didn't find any negative effect on employment, which is positive. And we have very high revenues that were raised. Now, how could this tax improve? And maybe this is something that can be done of the lessons learned from Mexico, is how can we improve the tax? So first, of course, annual adjustments for inflation are very important, so the tax doesn't lose its value, but also adjustments to economic growth. Mexico is growing, so we need to make sugar-sweetened beverages less affordable. So if there's economic growth, then people can buy more. The tax needs to be increased. It's a moderate tax. It's a 10%, 1 peso per liter. It could be increased to 2 pesos. It is difficult because the industry opposes any increase, but a higher tax would lead to higher reductions in consumption and potential benefits on health. We need to think about the feasibility of adding to the actual tax, to the excise tax, to volume, a tax that penalizes in terms of sugar content. So that would lead to reformulation. We don't want to lose the tax that we have, a volume tax, because this is a signal that these beverages shouldn't be consumed. And it reduces the gap between prices, that there's a high variability in prices in the country, but it would be interesting to try to see if we add another component, how much of an effect would have in terms of reformulation. Of course, we need to make awareness and ways to assign resources to compensate to correct externalities, because the tax that was implemented in Mexico was framed like that, to correct for externalities. So that will be with availability of water in poor areas. We don't have potable waters in all areas in Mexico, and subsidies to healthy food. So it would be very interesting to use the revenues to subsidize healthy food. Particularly would be a benefit also for the agriculturers that we need to import. We import a lot from the US after the trade was approved. So again, I think we all understand that the tax is only one component of a comprehensive package for the prevention and control of obesity and non-communicable diseases. This is key. This is not a magic bullet. So in Mexico, we need to improve and evaluate the other strategies that we do have, but they need to be well evaluated and enhanced. Of course, we need also to think about more structural policies to modify the food system, not only in Mexico, but in the world. We are in the bad direction because these unhealthy foods are more affordable, and we should incentivize the production and distribution of healthy options that are more affordable. And again, the evaluation of the tax should center on affordability, on changes in prices and consumption. And then we can do with simulations or based on the literature that one would expect changes in health, because it's a challenge to evaluate the effects on such a distal outcome. So this is what I wanted to present. This is the list of all the participants. I'm presenting on behalf of a lot of people who collaborate, who've been collaborating in all these studies. And of course, I don't have any conflict of interest to declare. And I thank you very much.
Thank you very much for giving us the Mexico story. You keep the mic because I'm sure you need one or two questions or queries. We have, Barry, we have two questions from the off-site listeners, viewers for you. But let us deal with Arantxa's presentation, which is related. Are there any comments, questions? Yes, I see two hands. Please, there is a mic. We have a mic for.
Yes. Question. Were there any studies done to see if the companies benefited? In other words, they were now reducing their expenditure by not putting enough sugar. Were there any studies to see whether they benefited from the whole process, or were companies closed down because of the change?
Could you repeat the question?
I would want to know from the side of the companies, these companies that made these sugar-sweetened beverages, if they benefited having, in the situation where they didn't have to put so much sugar, in other words, their costs for sugar, did they benefit at all from the process?
So you're asking if they reformulated the companies?
If the companies benefited from the process.
Well, so what we see is that consumption, this is a very interesting question, because we found that consumption and sales, I didn't show the sales, dropped after the tax was implemented. But keep in mind that I also showed that there was an increase in bottled water, and they produce most of the production of bottled water is from the beverage industry. So in that sense, what one could say that they benefit from that.
Not exactly your question, but you see that because we have a company here that does water as well as beverages. So I can see if there's a tax on that, they will benefit, as they are, because of the rumors on the water sales right now. There was another question online for Barry or for both. Yes.
Dr. Colchero, Miriam would like to know if you were able to track the purchase or consumption of powdered drinks, which may be a substitute, especially for low socioeconomic status persons.
Of what? Powdered drinks. So powdered drinks have a tax also. So the powders are included as the taxed beverages. So there was a reduction also. We didn't disaggregate it as much, and powders are not consumed as much as in other countries in Mexico, but all taxed beverages had a reduction.
Another question, yes?
Marhisha would like to know how exactly the industry objections were tackled when the taxations were implemented.
So the industry before the tax was implemented was starting to say that the obesity is not caused by consumption of sugar-sweetened beverages, that there were many factors and why sugar-sweetened beverages. But they're not saying that anymore. What they were claiming that there was going to be losses in employment, and we show it didn't. Most of the argument has to do with what they say is that the tax is not working because there is no effect on health. And it hasn't been proved that there's no effect on health. There's no studies showing that there is no effect. There are 2 simulation models looking at potential effects on health, positive effects on health. And the literature clearly shows that if you consume sugar-sweetened beverages, then this is related to weight gain, diabetes, and chronic diseases. And if you reduce consumption, then you reduce the probability of having these diseases. So, but this is what they've been saying. In Mexico, the strongest arguments now are health and that the taxes are regressive. So they do not take into account the overall losses and gains to see what happened with the poor. No, the reductions among the poor were larger, and they don't say that.
You introduced the volume tax, right? Was there much thought given to taxation by tiers? Those below a certain level will be free of tax. If you have a sugar content there, it's a 1 peso, and if it's there, it might be 2 pesos. Was that considered?
So before the tax was implemented, we had meetings with the Ministry of Finance, and what they thought is that the volume tax was easier to implement. They thought they said, I cannot read the labels. So it would be very difficult to implement and monitor the compliance of such a tax.
Questions? You? Oh, yes, come. Well, say what you wanted to do.
The companies responded with differential pricing. Did that have any effect on their sales volume? Because they were selling bigger packages at a lower cost to the public. Was there any change in their sales volume, and was there any change in their profitability?
So on average, prices increased. So on average, but then there were some differential. And so we don't know about profits. We don't have information on profits. We have information on sales. So crude sales did not decrease. So it's just when you adjust and look at the evaluation, at the effect of the tax, that you see that there were reductions in sales. But there was no effect on employment.
Okay. Arantxa, you will pardon us, this is very important, and your experiences, so we are going to take as many as we can on this because you have the practical experience. Somebody else offline?
There are several questions online.
Take 2 more.
All right. Someone wanted to know if in Mexico, if bottled water is more affordable and more accessible than sugar-sweetened beverages.
Okay, this is a good question because so in Mexico they're more affordable, but most people buy these big containers of waters that buy for their household. So in terms of liters per capita, peso per liter, they're less expensive.
Barry, I'll bring, okay, you can come. The question came in late for you, Barry. Regarding the obesity in India, and I suppose this is coming either from Trinidad or Guyana, but anyway, regarding the obesity in India, is it mainly genetic in its cause?
The obesity is not genetic in its cause. What is genetic for Indians, and it's also true for this country, is that there happens to be more adiposity, more fat around the heart and the liver than there is among whites from Europe and like in my country that come from Northern Europe. At the same time, the percentage of body fat for the weight for Indians is much higher. So South Asian Indians that migrated to the Caribbean, like that migrated to the UK, we have shown in dozens of studies, have a much high, for the same weight and the same BMI, have more body fat. And it tends to be around the heart and the liver. So at a BMI in India of 21, 22, 23, they're already pre-diabetic or diabetic. Whereas in white Americans or Brits or Scandinavians, you find that it's a BMI of 27 to 29 to get the same level. So Indians, part of the Caribbean islands, certainly the Andean region up from Mexico down to Chile, are all areas in Asia itself where there's a much higher propensity to have extra fat around the heart and liver and extra fat for the same weight.
Okay, thank you. Last question for this session, and I think that both of you can answer. It's a question of the pass-through, the tax pass-through. If the companies absorb the tax, was that an experience in Mexico? Were you able to measure that if the effect is the same?
Okay, so as I mentioned, in rural areas, so that's about 15% of the population that live there, 20%, they absorb part of it. So there was an increase in price, but not 1 peso. It was 0.7 cents. So they absorbed a little bit, and they absorbed for the poorest region, and there was a differential by packet size pass-through. In urban areas, on average, there was a complete pass-through, and it was higher in the carbonated than in the non-carbonated. Probably at the end, it's not that they are losing or it just...
Right. And the only country where we've actually seen less pass-through than the tax in a significant manner is Chile, where they had a really small tax of 5%, and they passed it through in a higher level for the higher income areas, but for most of the country they didn't, and the impact has been insignificant. It's too small a tax, and they could absorb it. But once it's gotten higher toward the 10 to 20%, like in Berkeley and in Mexico, we've seen the pass-through.
Right now, the 1 peso is about 10%, right?
It's about 10%.
WHO recommends 20%.
Yeah, it's small.
Are you moving to that?
Well,
20%?
Yeah. So the proposal is to increase it, but then there's a strong opposition from the industry, and the groups, the advocacy groups, have to do a lot of work.
Thank you very much.
Thank
Please
you.
give them a round of applause.